Welcome to our first episode of Bula Wellness on FBC TV. I am your host, Dr. Neil Sharma. I acknowledge all our viewers from across the country. If you're from the west, north, the outer islands, and not forgetting the great central and eastern corner of our beautiful nation, welcome. Bula Wellness is based on making your health and wellness part of your daily life. Each week, we cover a different topic. This will be done through interviews with experts, testimonials, and of course, finding out your views about these topics. This week, we talk about non-communicable diseases, or NCDs for short, and we are focusing on diabetes. Diabetes, heart disease, cancers, and mental ill health are examples of NCDs. NCDs are increasingly becoming a major health risk. We in Fiji are no exception. Being obese and being grossly overweight carries greater risk of NCD. The World Health Organization's recent reports show Fiji ranked as the fourth most obese population in the Pacific after Nauru, Samoa, and Tonga. So it's obvious that you must take prevention and screening seriously to improve the quality of your lives and that of your family. I implore you to work closely with our international partners, NGOs, civil society organizations, and the health ministry to make this happen. If you don't take awareness to the next level, then NCD will cause much more severe illness, disabilities, and premature deaths. It is important to note that all NCDs present diabetes remains the biggest danger in our communities. Therefore, it's appropriate we start this first episode by addressing some of our health concerns on diabetes. I have a question for you. How much do you know about diabetes?
I think that diabetes is a disease that's caused by the choice of lifestyle that we live, and I think it's based on the type of food that we eat and maybe the type of activities that we're involved in.
Diabetes is a form of disease that results in high blood sugar levels.
Diabetes is a non-communicable disease that usually occurs when it's not invited in the disease. That was my understanding about non-communicable disease.
Diabetes is having a high blood sugar in your blood.
It's a disease that is caused when there is too much sugar in the body.
I think it's mainly of the food nowadays that there is more medicine that are put onto it that causes diabetes.
An unhealthy diet.
Diabetes is caused by a type of life that we live we live every day. Sort of food we eat, what we drink.
Too much consumption of high sugar stuffs like sweets.
It is caused by the lifestyle that we choose, what we eat. We overeat certain things that contribute to diabetes, and we don't do enough exercises.
Eating the right food, the right time, healthy food, living food from the garden that you can pick it and eat it.
Eating fruits, I guess. Having a healthier diet.
If diabetes is caused by our lifestyle, all we got to do is to change our lifestyle.
Just controlling your appetite in eating habits like that.
I think the choice, maybe I can say the choice is up to us, and we can actually control it by eating the right type of food And when I say eating the right type of food, maybe not overeating those that contribute to diabetes, like for example, overtaking sugar, eating too much of things that cause diabetes. And so which means that we just have to know which type of food is it that we should cut down on or not take in large quantities.
Coming up next, we have a guest to answer questions that I'm sure many of you have been asking. He will simplify the complicated messages you have been receiving and help you understand them. Who better than to advise us today? Dr. Tukana from the Ministry's Wellness Center. Dr. Tukana, welcome to the show.
Bula Wellness, sir, and Bula Wellness, Fiji.
Thank you for making time for us to discuss a very pressing health problem in our communities. We will discuss the efforts put in place to assist the general public to identify persons at risk of diabetes, what they can do for themselves at home, at health facilities, on outreach programs by NGOs and ministry staff. Just to start things off, what is diabetes and how bad is it?
Thank you. Diabetes is about sugar in the blood. We have a normal level of sugar in our blood, and when somebody says you have diabetes, then the blood levels, the sugar levels in your blood is above the normal. We sometimes talk about fasting blood sugar, where the level is above 7, or random blood sugar, where the blood is below 10. Those are the two numbers that you need to know about diabetes. So diabetes is about increased sugar in our blood that is above the normal.
Very interesting indeed, Dr. Tukana. We'll go for a short break, but stay tuned for more right after this. Welcome back to Bula Wellness. We have Dr. Tukana from the Wellness Center with us today. We are talking about diabetes. So, Dr. Tukana, earlier you mentioned that diabetes has become a major problem in our community and it is associated with high sugar levels. Would you like to elaborate a little bit more?
Thank you. Our sugar in our blood is controlled by a special organ, which we all have. It's called the pancreas. And the pancreas, it produces something we call insulin, which is responsible for making sure that the sugar level in your bloods remain normal. I've used two numbers. One is 7 and one is 10. And when the insulin does not work properly, and there are some conditions, one you have said, which is obesity, is one of the factors that stops insulin from working effectively, meaning insulin will not be able to control your blood sugar well in such conditions. And when it doesn't work properly, insulin does not work properly, and that means sugar control in the blood will be affected.
Okay. So there are some specific questions we have for you, Dr. Tukana. There are different types of diabetes. What is type 2?
Type 2 diabetes, Dr. Sharma, is a condition where you have a pancreas and the insulin is produced by the pancreas normally. But there are certain situations, one as I've said, obesity, and there are other factors known in the world. There are 4 factors actually: smoking, poor nutrition, alcohol, and lack of exercise. These are 4 conditions established in the world over that stops the insulin from working perfectly in the body. Those are the conditions, that's when we call diabetes type 2 diabetes. So you have the pancreas, you have the insulin bin, but it's not been able to work properly in our body to control blood sugar.
Thank you. So what actually happens is there's the pancreas, there's insulin being produced, but maybe not enough, or not to be enough to be shared around because of obesity, because of the other factors which curtail its effectiveness, and then high sugar levels which flow out into the urine. There's thirst, there's a lot of urine, and there's loss of weight. These are some symptoms which develop.
That's correct, sir.
Now, the second question we have today is what target organs are affected in diabetes type 2?
The target organs, we simply call it snake. And snake refers to the skin, where we have numbness of skin, maybe discoloration, and we have the nerves is affected, where the feet become numb, there's numbness in the body. The arteries, the major organs in the arteries are the heart organs, the kidneys, which is a key part of the snake, and the eyes. There are 5 target organs, which when you don't control diabetes, these are the target organs: the skin, nerves, arteries, kidneys, and eyes.
It definitely is a poisonous snake.
It is a poisonous snake.
So it's important that when patients get diagnosed with diabetes, that they look after their eyes, their heart, their kidneys, and look after their limbs where the circulation is impaired, so that they don't develop complications.
Correct, sir.
And if they do develop complications, it can be quite a problem in the quality of their lives.
Yes, sir.
Okay, the third issue today is great effort has been and information on diet control and increased physical activity has been provided by the Ministry of Health and its international partners. Have any results been coming forward on this impact?
We look at a few studies which we do in Fiji. Number one is we look at children who are 13 to 17-year-olds. We call that the Global School Health Survey. And then we look at Fijian adults. We call it the STEP survey, where we look at 25 to 64 years old. And the latest one is what we call the National Nutrition Survey, which we do every 10 years to sort of give us a snapshot of what's happening in the country.
Okay, and the results of some of these Step 2 survey which was carried out, what does it indicate? What does it show?
Just to take us back, in 1985, the level of diabetes in the country was simply just about 4%, which simply means diabetes was not much of an issue before 1985. It came into the picture through studies, and now we are sitting at around 16%, which means that the level of diabetes in the country has increased 4 times.
Oh, 4.
Yeah, 4 times.
That's very, very frightening. Eh?
That is very, very
Very
frightening.
frightening, and it will take a long time to change our lifestyles to be able to combat this and be able to control and stall it. The next question I have for you, is there a role for traditional and alternate treatments in diabetes and its complications? I was specifically thinking about traditional food, and the other thing is how we treat our foot when we get infected and we have diabetes. Patients tend to leave it rather late. I would like your comments on this.
Yeah, what has actually happened, and we found out from 1985, we found that we have shifted away from eating our traditional foods, the different ethnicities in the country. Simply saying that we have moved more into processed food and sort of living or underestimating the health power of our traditional foods. Very much in the issue of fruits and vegetables. It was found in our latest STEP survey that only 15% of Fijian adults eat enough fruits and vegetables a day. And that we mean by 400 grams or 5 servings of fruit and vegetables a day. 15%. That means 85% do not eat enough. And it was a traditional thing. We eat a lot of fruits and vegetables before, which we are living now. Right? The other thing about the foods is the importance of, if you are a diabetic and you have infection in the food, is to get it sorted out by the medical facilities. Simply mean that we want to arrest the increase in infection. People with diabetes tend to have healing of their foot infections late. So it's so important that you come to the hospital and get your feet checked.
Yes. Thank you. I think it's important that we listen to this advice, that foot care is a very important component, especially if you are diabetic. The next question I have is, the costs associated with good control of diabetes is an issue many a times. Tell us about the cost of glucometers and glucose sticks. Recently, in the retail pharmacies, we've noticed that glucometers cost under $20. And that's very reassuring because, we can make this available to a lot more people. However, the cost of glucose sticks is very expensive, somewhere in the range of about $45 for 50 sticks. Do you have any thoughts on this?
That's correct, sir. It's one of the difficult issues that we are facing now, or one of the challenges is talking with the industry to lower the cost of these important things. We must remember that we need the glucometer and the glucose sticks for our people who have diabetes to be able to control, and it's becoming one of the biggest barriers in the control of diabetes is the unaffordability. People are not able to afford the cost, particularly of the strips and the glucometer.
True. Because once you have the glucose sticks and your glucometer, you have a better control of what to eat, and what volume will create high sugar levels. So it helps control it in the long term. The other question we have today is, can we as community and society stop the rapidly increasing incidence of diabetes? Your thoughts?
Yes, they're just, if you have been listening carefully to our talk today, sir, there are three issues. Number one is lifestyle. It's been clearly established. We don't have to create new evidence in Fiji. That's smoking, one. Number two is eating a balanced diet. Number three is responsible drinking. And number four, exercise are the key risk factors for NCD. We don't have any medicine for these four lifestyles. It's upon the society and the community for us to work together and talk to each other on how we can improve by improving the environments. Some environments was make a playing field, or have a food backyard gardening, or have an exercise plan for the family. That's the lifestyle part. The second part is, as you grow older, when you reach 25, you should make a habit of coming for screening, because early detection is very important, simply because in NCDs you don't have symptoms like cough and fever, which brings you to the hospital. With this group of diseases, you need to come forward, and we need to screen you, and you need to be screened so that we can see how is your pressure, how is your sugar, how is your cholesterol, what is your weight like, what is your waist circumference like.
Thank you.
Yeah.
What you very succinctly put to us, the importance of lifestyle changes, and that these lifestyle changes are easy, totally doable, and it needs to be sustained to make it happen. And then, of course, you've talked about annual screening, the importance of regularly after the age 35, having yourself screened for heart disease, for diabetes, ensuring that you're in your ideal body weight, and maintaining that active lifestyle. And the next question I have for you, Dr. Tukana, for checkup and treatment if needed, where can people go? I've heard about diabetic hubs. Tell us a little bit more about the hubs.
Diabetes hubs is, as the word suggests, it's a one-stop shop where we can give you all the services concerning around diabetes. We can screen you, we can make get the necessary professional dietitian, a physiotherapist, or a counselor to counsel you on lifestyle changes, and we also deliver medicine, we check your eyes, and we check your feet, all under one roof.
A brilliant approach, because it makes it easier for patients to be coming into under one roof, having it all sorted out. Finally, do you have any advice you'd like to give the people about diabetes or NCDs in general?
We have the solution to NCD in general. We have the system, and we also have the lifestyle which we could change. I just believe that we just need to understand more about the disease and work towards one, changing your lifestyle, two, annual screening, and three, take your medicine religiously and make sure you follow the advice of the doctor.
Thank you very much, Dr. Tukana, for your expertise. I am sure all of you will consider raising your awareness and support individual and community-based programs, especially for screening, preventing and controlling the wildfire of diabetes, Join us for more right after this. Welcome back to Bula Wellness. Earlier we had a very informative session, question and answers with Dr. Tukana. I do hope you have learned a few things about diabetes and how to go about getting yourself checked and monitored. Do you know that there is a diabetes type 1 too? This type 1 is becoming a lot more visible, especially in the young. We are picking up new cases in the children's ward, in adolescents and young adults too. However, that is a story for another day. After our educational and informative session with Dr. Tukana, we have several take-home messages, so please pay close attention to the following notes. Obesity and diabetes are increasing very rapidly. 1/3 of the population is at risk of diabetes now. Obesity is followed by diabetes generally. We need to be lifestyle screened. If we are carrying any risk, then measures need to be addressed immediately. Traditional diets, which included a lot of vegetables and local fruit, are recommended with strict limitation of salt and additional sugar intake. Traditional diets kept our risk low. Home-cooked meals are the best. Fast and modern takeaway meals eaten regularly is not healthy. Salty, fried, fatty foods are causing obesity and diabetes follows. Restaurant and takeout meals should be considered as a treat infrequently. Fizzy drinks are full of sugar and salt and are harming your health. Use occasionally and limit it to a small can or bottle as a treat, if at all. I notice a lot of adults buying junk food snacks for children along with their groceries. This is not good parenting. Children in the home and in school should be taught gardening and healthy cooking and eating skills. There is merit in suggesting to some of our corporate food industry to consider promoting a young Fiji child chef program on TV. Interesting, educational, and entertaining. What actions can you take to raise your awareness and to be screened? Diabetic screening is available at the diabetic hubs, health centers, and nursing stations. Your general practitioner can assist make the diagnosis and help you return to normal with diet and physical activity changes. Your medication should be readily available in the health facility and retail pharmacies. Glucometers are now available at very economical rates. The cost of glucose sticks available via the Fiji Pharmaceutical Services and its distribution by hospital outlets and retail pharmacies must be addressed by our health officials. Take these notes to heart and please share them with your family and friends for the betterment of your lives today and for your children's tomorrow. Finally, monitoring your health status is a vital part of everyday living, so it is very important to ask yourself the following questions. Am I overweight or obese? Am I losing weight? Am I thirsty all the time? Am I passing urine frequently? When and where can I be screened? Am I taking prevention measures? If I am already diabetic, am I doing enough for myself? Should I lose weight? Take my medicine on time, exercise, be followed up, and assist my health team prevent complications. If and when complications set in, who will support me and then my family when I depart prematurely too? So make sure you take time out and ask yourself these questions. And if in doubt, remember there is always health officials available at your local health centers to answer any questions. Unfortunately, time has caught up with us again, and that brings us to the end of our first episode of Bula Wellness. I hope you have enjoyed the program, learnt a few things that could change and even save your life and those whom you love. If you have queries about the show or the topic today, you can contact us on Facebook, Bula Wellness FBC TV, or write to us, bulawellness@fbc.com.fj. Make sure to join us again the same time next week for our next episode, where we will address the subject of antibiotic misuse in the community. Until then, remember, health is wealth. Good night.